We are in the home stretch. So last presentation, and we're ending on another in-person presentation. So Cole Kennedy from University of Victoria. Am I right that it's in? Yes, good. Okay. He's talking about clinical management of concussion in sport, lessons learned from athletes' experiences. Cole is a second-year Master's of Science student in the clinical neuropsychology program within the Department of Psychology at the University of Victoria, under the supervision of Dr. Mauricio Garcia Barrera. Cole is a member of the Cortex Lab and has been involved with concussion research for several years in various capacities. Most recently, he has taken a position on the BC Consensus Building Project, a 3-year ministry-funded research initiative addressing the intersections of brain injury, mental health, and addictions in his home province of BC.
Hello, everyone, and thank you for that wonderful introduction. It's a pleasure to be here. It's my first time here attending this wonderful symposium. Hopefully you will have me back for this. So today I'm going to share some research with you that was conducted 2 years ago as part of my honors thesis and with support of members of the Cortex Lab. We all know what sports concussion is. We've talked about it a lot today, but most of the previous research has looked at sports concussion through quantitative methods, which often don't capture athletes' perspectives. So the purpose of this study was to explore elite athletes' lived experiences of sport-related concussion, or SRC, through qualitative interviews. Participants were 19 Canadian U sport or university sports, soccer, rugby, volleyball, and basketball athletes. The average age was around 21 years old, and 47% of our sample was female. Here are the average concussions organized by sport type. So we had every athlete in the study had experienced at least one SRC within the last 4 years, and the range was 1 to 8, with the median being 4. So what we did is we conducted 1-hour semi-structured interviews. We did this over Zoom. It was during the COVID-19 pandemic, and we recorded these interviews, transcribed them, and then used thematic analysis facilitated through the qualitative software in Vivo 12 to identify patterns across the transcribed interview content. So I've already had the pleasure of presenting on theme 1, but I'm excited to share the results of theme 2 with you all today for the first time. So theme 2 was athletes' experiences of concussion management, and it contained 3 distinct yet related sub-themes: continuing play despite active symptoms, omitting symptoms, and premature return to play, all of which were characterized by poor adherence to SRC protocols. In terms of the first sub-theme, we found that 85% of athletes reported 1 or more instances where they remained in the game following obvious impact to the head or neck and despite experiencing active symptoms. Throughout the presentation, I'm going to share some quotations to provide not only support, but nuance and context for our results. And just note that these are, of course, pseudonyms to protect the participants' identities. So this is a quote from Trevor, 22. He's a rugby player with 6 lifetime concussions. He said, "I went to make a tackle, got kneed on top of my head and split my head open. I was amped up, it was a close game. I went off, had my head patched, and then finished the game." So we can see that athletes are playing despite symptoms, playing despite obvious impact, and really in no circumstance should this be acceptable, especially when it comes to an open head injury. Here's a similar quotation. "I felt my neck crack when I hit the ground. It was our playoff game. I got up, let's go, let's do this." In terms of our second sub-theme, omitting symptoms, athletes reported tendencies to underreport SRC symptoms on both sideline evaluations. So this is after a hit occurs, as well as follow-up or return to sport assessments. It's worth noting too that during these interviews, I did them all myself. Impact and C.E.T came up quite a bit, and we've talked about them today. And athletes omitted symptoms on both of these or sandbagged their performances on C.E.T or on the impact. Trevor says, you want to play. It's easy to hide symptoms of a concussion. You just say, no, I'm not nauseous. No, I don't have a headache. Jody says, I was being truthful and honest, and then I realized second month, I was mad about that. I'm going to lie. In terms of our third sub-theme, premature return to play, we found that athletes frequently reported instances of returning to play while still in recovery. Stage 6 of the return to play protocol requires that symptoms are not experiencing active symptoms, and this is not the experience reflected through our study. Most athletes acknowledge the potential consequences of going back too early, but it seemed that the competitiveness and the drive to return to sport outweighed that. There's a quote from Damien. He says, I've had a lot of concussions. I feel like every time I get one, I say one more, that's it. Then it happens again. I almost always rush back into it and make it worse. Here's one from Craig. He says, for me personally, I never treated them as a big deal. To be honest, never took time off. That's who I am. I'm more likely to push an injury than heal it. So all of these sub-themes put athletes' health and well-being at risk, but I think it's important not to blame the athlete themselves. It's really the protocols we have in place and the systems we have are insufficient and don't always address some of the personality characteristics of athletes and the challenges they face and the system they operate within. There's various internal factors such as competitiveness, which I've talked about already, and I'm sure you could kind of see through those quotations, but as well as external pressures, such as pressure to perform from fellow athletes, team members, coaches, and athletic staff. There's some quotations there. And of course, it's difficult to tackle the overarching influence of sport culture. You can see this quote here, and it reminded me of the quote that Dr. McKee shared from Tom Brady, which I had not seen before, but this idea that it's inevitable, you just get stronger from it. That's a pattern that we observed in our study as well. Our findings support the need for more objective methods of evaluation, so taking the onus off of athletes to report symptoms, such as blood and saliva-based biomarkers, as well as formal legislation. We've talked about Rowan's Law a lot. In BC, where I'm from, we don't have such formal legislation, so we're definitely behind there. I just learned of PPM 158 today for the first time as well, so Ontario is leading the charge there. But I did want to make a shout out to one of my close friends, mentors, and colleagues who is leading Bill C.E.T.S, the national strategy on brain injury prevention, and that's Janelle Brees. I also, our findings show that we need more individualized care, wraparound care, and multidisciplinary care to address the health and well-being of athletes. Just to end on a personal note, as a student, this is some of my previous work, but I'm still yet to publish it. I'm hoping to do a knowledge translation. Working with these athletes, I heard a lot that they want to be involved in the research, more engaged. So we're hoping to make a video of some sort, a short video. I recently applied for funding, but I didn't get it, but I'm not going to give up. I have an upcoming conference 2 weeks from today. It's the 11th annual Sports Concussion Symposium, so not to be confused with today's event. And I'll be sharing some similar research from this qualitative data as well, from theme 1. And finally, we, as mentioned in my introduction, I'm a part of a team, the BC Consensus Building Project, and we are addressing the intersections of mental health, addictions, and brain injury with a focus on intimate partner violence this year. It's a community gauge project. It involves over 200 stakeholders of diverse backgrounds. So maybe next year I'll be able to report on the findings of that. And lastly, this is my baby, the Decision Map project. It's my master's thesis, which I am in the midst of completing and hope to be able to share with you all at some point as well. That's it. It's my pleasure to be here and to be the last speaker today. I know everyone must be very tired. It's been a long day. I myself am battling the time change, so it's worse. But I do want to acknowledge everyone in my lab, all of the organizers today, as well as, of course, the participants who shared their stories and their courage to share their stories with me for the purpose of this research. So thank you.
Thank you, Cole. Great talk. And you're reminding us of how far there is still to go. Charles?
I enjoyed that tremendously because I can appreciate the difficulty of athletes accepting that they are impaired and they have to go back into play. And it's a marvelous reference to Rowan Stringer, who clearly enunciated those same sentiments and then went back and died. So it's a very important area of research that you're undertaking. Is there anything remedial that you can recommend? Like, how do we enforce this idea that, well, with younger kids, we use the expression "kids must tell." How do you approach older people to try to improve compliance?
That's an excellent question. It's something I think about myself quite often. In our keynote speakers talk today, we see that education might help increase self-reporting. But in my experiences interviewing these athletes, most of them are aware of, like, they have excellent concussion knowledge. A lab member and a good friend and colleague of mine, Madeline C.E.T.S, she did a study in our lab which found that competitiveness predicts future concussion non-disclosure despite concussion knowledge. So I don't know if education is the only piece. What I can say from my experiences in this study is that peer support is a big piece. And I think even giving these athletes a platform, maybe more senior athletes can speak to younger incoming athletes in a university sports setting, share their experiences, and maybe that will help resonate a bit more, having that kind of peer line of communication open.
Thanks for a great talk. And I'm often reminded when people present this, which, you know, these people actually are in a more a stage of awareness. You know, a lot of the players I see they were professional athletes at a time where people didn't even recognize what a concussion was. Right. But again, I'm always struck by the fact that we seem to forget that judgment also lives in the brain, this concussed brain. And so as long as we're still asking people whether they're okay to play, I feel like we're not going to get very far. And so I do agree that, you know, these biomarkers or some other person, I mean, I guess the NFL is taking it to the other level where they're making the decisions. But I often think that has to be an approach in these cases, because yeah, they're ultra competitive, and you know, some of them have AAA personalities. So yeah, I really appreciate your talk, and it is almost disconcerting to hear and disheartening that they still want to play. Somebody actually asked a question online, which I thought was a really good question, is what about socioeconomic status? Because actually some of these players have to play for financial reasons. And have you guys looked at that?
That is an excellent question. First of all, I completely agree with everything you said. We need to take the onus off athletes, and we need to develop better systems and protocols and rules that can support them. In terms of socioeconomic status, in the interviews that I did, there was a few athletes who reported to me that they weren't sure what would happen to their scholarships if they weren't able to play. I believe the university I come from has a rule 4 concussions a year maximum, or you're pulled from sport. And I did have one athlete that disclosed they had more than 4, but they were at risk of losing their scholarship, or even if they weren't particularly at risk, it wasn't transparent in how that system operates to them. So I think we need to eliminate the kind of financial piece out of it, certainly. In terms of people from lower socioeconomic status, there's a lot of advantages to sport, and in terms of academics and the WHL, for every year you play, I believe it's a year of university paid for. So if we can help eliminate those economic barriers, I think we can create a safer environment for athletes' health.
There's another question online.
Hi, thank you. Very informative presentation. As we discussed right now, it seems that competitiveness could play a role in disclosure of concussion symptoms. So I was wondering if you considered conducting some sort of gender-based analysis on your data to see how competitiveness may present differently or similarly between men and women.
I haven't, and that's an excellent point. That would be something that I should follow up on. So thank you for that idea.
No worries.
But I believe in my colleague's study, she did do an analysis based on sex, and I don't believe she found any sex differences. And anecdotally, having done these interviews, it was almost 50-50 in terms of male-female sex, the sample, and I didn't find many differences. Even in those quotes, you can see male or female, that kind of, I'm getting up, let's go, let's do this, I'm finishing no matter what. That's, I don't know if that's as much of a sex thing as it is an athletic thing.
Because within the sport world, it could be a common trend for both men and women. I was just wondering if you noticed any trends. Thank you.
Thank you.
When history is prior to making a diagnosis. Despite 30 years, and Charles has 40 plus years, he may have figured it out. I haven't. So how do you take the athlete out of it? And I just don't think it's realistic, really, to take out the other considerations. Money is one thing, fame, fortune, feeling part of a group, which does enhance one's social being. And therefore, God is a parameter towards greater health. I think there is an element when it's obvious and there's signs, but I would say a significant number don't have signs that we can clearly identify as being concussion.
Yeah, I certainly agree. And those are the challenges that we're up against, right? That we're faced with. I don't know if the solution, I wouldn't say take the athlete out of it. I think we need to take less of the burden off of the athlete. I don't know if we're ever going to reach a point, and I don't know if we should reach a point where it's completely objective. You know, we still don't fully understand concussion and how it presents in athletes and other populations. So we definitely need to make sure the athlete's voice isn't removed from the conversation. However, I think there's a lot of promise in blood and saliva-based biomarkers. If we can do a field side, a saliva sample and test in my dreams, at least that will take a bit of the onus off the athlete, and we can confirm some of their challenges. But yeah, it's a good question that I don't fully have the answer to.
I'm not as confident with the markers. Because it always, at the end, the reason they won't replace physicians with robots, even in AI, is because there has to be a folder. So someone has to make a decision, putting these together, and I don't think you can take that away. But mindful and also appreciative of your insights.
Thank you. Yeah, I guess I'm just very optimistic.
Can I
Yes.
I concur with you that you wouldn't want to completely take the athlete out of there. It's the athlete that has to report their symptoms, but I think the suggestion was to leave that final question, the final decision to them of whether or not they're okay, whether or not they think they should play to the athletes. That's what I understood was the recommendation. So it's, I think you.
Devil's in the detail, and
Yeah.
today's buzzword is shared decision making.
That's another point, but yeah.
Yeah, certainly. Thank you.
Oh.
Yeah.
You sparked a lot of discussion.
I thought everyone would be asleep by now, so
Yeah.
good job.
Commend you for bringing voices of the athletes and doing qualitative research. I think hearing those voices and those experiences and what athletes are going through when they're having to make those decisions is really important to know. And we can't now unknow that. So knowing what we know, how do we go forward? And it is a fine balancing act, right? With, you know, to still honor that voice of the athlete and their experience of what they're going through. But, you know, when you look at all those signs and symptoms that we keep seeing on the screen, it shows impairment. And so when someone's drinking and driving and they're impaired, we don't ask the driver, are you okay to drive home? Like, you know, like you seem okay, like, you know, can you drive? So I'm thinking like, you know, sort of that shared experience of like when you see in the professional light, where there's so much, you know, so much of a team to help make that decision and take maybe that burden off the athlete. So perhaps providing that supportive environment to make it a little bit easier on that athlete to take that pressure off, say it's okay, right? We've got this, your team's got this. So maybe working on being concussion aware and creating a culture of care to support those athletes. Yeah.
I completely agree. Yeah, you spoke so much more eloquently than I could phrase it. And I think a big piece of that is coaching staff. They're like who the athletes look up to, that's their role model. And if they don't set a good example, athletes are aware if your coach looks the other way, they know. So that sort of environment will discourage them from reporting their concussions. So it's an excellent point, and I think we can start with coaches.
I can give an example of where the athletes have been taken out of the final decision. In the world of motorsport, and Charles knows that I've been involved in 50 years, in Formula One, IndyCar, NASCAR, at the top levels, if the force of impact is more than a certain number of Gs, there is no question that the athlete gets fully tested and a decision is made of whether they can actually stay in the park or have to leave, and they have to pass a whole series of exams in recovering before they're allowed even into a simulator, never mind practice, never mind qualifying, never mind racing. Because if they come back and they're impaired, they're a huge risk to other drivers on the circuit and to the people around the circuit. We've made it very clear, these are the rules, and they know the rules. And we've learned from what's happened before with some drivers who came back to race and just were never competitive and were dangerous. That's what we did.
Thank you for sharing that. And that's such an excellent point. It's not just their the individual athlete, but it's also their team and the other people on the field or whatever it be that are at risk by an athlete staying in the game. Yeah, no kidding.
Are you standing to?
Okay, that's it. Thank you, everyone.
Thank you, Cole. I was thinking about competitiveness. Our greatest strength is also our greatest weakness. Wise. So I want to thank all of the speakers from this afternoon. That was just a wonderful set of talks. And I want to also thank the audience for their engagement and participation. And lastly, I would like to thank Charles, because I know he's not going to thank himself, for all of his leadership with the Canadian Concussion Center, his stellar leadership, and of course for this conference as well.
So while we're thanking people, let's thank Robin and Carmela for being excellent chairs. And Mojgan, thank you to you for organizing. And Christian and Kim, if you can hear me, we're grateful to you for doing the technical stuff. And thank you to the audience. Our speakers were fantastic today. We learned a great deal. It was a terrific learning experience. And please have a safe trip home, especially if you're in a motor vehicle. And we would like to see you next year.